Care doesn't only happen in hospitals. Sometimes it happens in the places people gather every day. Places like a neighborhood barbershop, where looking good may be the goal, but feeling good matters just as much. Here, a group of nurses have come together to create a space where care can begin. Led by Arnetta Shaw, founder of Black Nurses Networking, these nurses are bringing health care directly to the people, offering free blood pressure screenings, conversations, and something just as important, trust. But their work goes beyond the cuff and the numbers. It's shaped by their own journeys as Black nurses, the patients they've cared for, and the stories that stay with them long after the shift ends. This is the spaces between. This is their stories.
You get a nurse because you're like, oh, I want to help people, right? And you do. You find yourself, right? You find yourself actively helping people, like you're doing the right thing, and then you realize the system that you work in does not. They don't give a damn.
It's not working for the people.
They don't want to hear none of that shit you talking about.
So my name is Arnetta Shaw. I am a registered nurse. My specialty is public health nursing, background in mental health, background in caregiving, background with some veterans. My current focus, though, is public health nursing, where I try to find any way possible to educate the community is what I'm doing. And the goal is empowerment. Empowerment in your health, empowerment in those doctor's offices, just making sure people get the information, because being in this field, I have learned the hard way how much people suffer because they don't know. They don't know anything. They don't know anything about their health. They don't know anything about the medical conversations that they're having. I've been a nurse that sat in a room with patients who are getting all this kind of information from the providers and just agreeing. And then the provider will walk out and say, all right, so you understand what I'm saying, right? And I'm like, yeah. And I'll sit back and be like, so like, do you actually know what was said? Oh no, I have no idea what they were talking about. So I'm like, all right, let me do public health, because I want to educate people where they are. Like, I want to meet people exactly where they are, exactly where they feel safe, and let them know it's okay to learn more, and that it's okay to participate in your health. Like, it's not just, oh, this is what the doctor told me I got to do, so I got to do it. No, it is, this is the health that I want for myself. And I'm able to communicate that with my providers so that we're on the same page and we're a team for my health, and not just I'm a child talking to a parent and I'm not feeling safe or comfortable. So because of that, I have my Christian sex ed, which is like unconventional places anywhere. I'm willing to meet people in the barbershop. I'm willing to meet people in the salon, the boutiques, the grocery store, to be honest, the bookstore, wherever we can meet to have that conversation about your health. That's where I want to meet you, because you might not want to come to the doctor's office because you don't feel safe, because you don't feel comfortable. But at least I can give you the education so that along the way, as time goes, you'll find yourself there and you'll be participating in your health. And the reason why I would choose this event, this community event, is because it's meeting people exactly where they are. They want to come to the barbershop once a week, every other week, however, but it's regular. And this is where they can come and get their health needs met or their like screenings done. And we can talk to them and make them feel comfortable to actually go into the doctor's office afterwards. So if we meet people where they are, like, this is the perfect event to jumpstart that conversation. And the fact that we're nurses who are, the nurses helping out today, we're all nurses that do some advanced practice stuff. We're all nurses who are master's prepared. Like, we understand how the system works. We understand how healthcare works. We understand how people work. And we can get out there and meet everybody where they are, educate you, and make you feel supported. What more could you want from being out here and putting those two things together, health and community? That's how
you talking about. It could be a full safety situation. Absolutely. You're outside. Like, I've been outside, like, at a home. Like, listen, this man is in a hospital bed with no sheets. Mm-hmm. It's doo-doo everywhere. It's nobody in here with this man. Like, we need to call the people, and they be like, oh, he be all right. You could just leave him here. No, I cannot. Like,
my way, or I'll be home in a few hours. Like,
and you can't leave them like that because not only will you not do that as a person,
it's unethical.
And how can you sleep at night?
It's against our license. Exactly. We actually take an oath that we will do the best that we can. Yes. Non-maleficence. Like, we agreed, we stated that we were going to do the best that we can for the people who live.
last week, y'all.
It's insane.
Older woman has had a history of epilepsy, has a lot of different forms. Her daughter was like, oh, okay, I'll be right back. I'm going to the mechanic. You want me to
stranger danger? Do you know me? You smoking crack? Oh no, we gotta fix this, baby.
She left.
Yes,
she left. I called her multiple times.
The things that you see,
an experience. And also look at the caregiver's point, because they never get 5 minutes apiece
to themselves.
So we know, because we understand it, like, yes, it is a burden, but if you want me to be here with your person, you need to know that I'm planning to be here for more than 10, 15 minutes. I wasn't trying to be here for 2 hours. I have another person I need to
how are you comfortable with that though? Like, how do you just leave? And you be like, oh no.
But you know what? I'd rather be on this side. And let me tell you why. Because there's so many different experiences where it's like, if I hadn't known this would have been the outcome. So, I don't take the position in 2018, blah, 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 all the stuff, all the schools, blah, blah, blah. Get that email last year. I'm like, man, I would love to go back into home care. This is the first red flag that we like to say, right? I was supposed to start August. I didn't start until October. Okay, maybe you're having some...
I feel like the
Yeah, cool. I am Shardell. I am a dually certified nurse practitioner in both psych, mental health, and family medicine. The goal of my care is whole person care, emphasizing preventative care, increasing access to care, and education on both mental and physical health. It's important for us to meet people where they are, and this is not to sound cliche, but we want to have access to patients. We want to give them access to our care anywhere they need it, whether it's the barbershop, whether it is in their homes, which I do as well. It's really, home care is really, really special to me. And I've been doing it for a significant amount of time, meeting patients where they are, meeting them where their needs are, and also increasing their access to care. I'm at a patient's house and I'm sitting down talking. She's like, girl, doing this stuff. And I noticed something running across my hand.
Oh no.
Y'all, and I'm like,
was it Mickey Mouse?
Was it a shadow?
Or Joe's apartment?
It was a shadow. Right?
Oh, it was Joe's apartment.
It wasn't. I actually would have been happy if it was Joe's apartment. I said, do you guys have bed bugs?
Oh yeah, you stayed in the middle of the floor. Oh yeah, that's why. Oh, sit down. Well,
no, I don't sit down, right?
Yeah.
So,
did you take off all your clothes to the basement?
I was ass naked outside of that patient's house.
Yes, child.
Literally.
We can't bring these motherfuckers
literally.
I think this is why I thank God that my dad is an exterminator though, because
y'all,
that shit right in some plastic bags immediately.
The reason why I'm traumatized, December the 2nd. I don't know if you remember, it was freezing rain.
Yes.
I'm ass naked, y'all.
No, because we don't want. Listen, if it's one thing, yo, these are two things nurses ain't finna fucking do.
I'm not taking them home.
You ain't finna stroll in with no motherfucking lights and no motherfucking bed bugs. Bag this shit up. No.
Immediately.
Yes, I'm not.
That should have been strike number 2. But I'm falling in love with the patients because I'm like,
they don't have
anybody else that goes out to the home for the home company.
That C difference ain't no good either.
Never.
C difference.
You know something is wrong.
Yeah,
that's another.
That's a definite.
For over 500 patients that I'm trying to go to their homes and see them.
You still had your brain cells?
Home care.
But this is what I'm talking about.
I love my patients.
That's a powerful case.
This is what I say about nursing though, right? Like, because when it comes to nursing, when I tell you, I was like, because you want to
understand the mental, like the dumping of a mental load. If I could stop all of this, because now I'm thinking for not only for myself, my family. Then you're like, okay, I have these patients that are really, really important to me. I want to make sure that I'm seeing them, giving them the care that they deserve. But then you had the politics of the company or whoever you work for. And even if you're an entrepreneur, you still got to answer to somebody. Whether it's yourself, whether it's,
regulated bodies.
Yeah, so it's like, and it's insane because they robbing you.
Because evidence-based care, the regulated bodies and evidence-based care,
they're not talking.
at all.
My name is Melissa Smith. I am a psychiatric mental health nurse practitioner, and I treat patients with mental health and substance use disorders. I'm here at the Chopped P.H.D. Barbershop today for a blood pressure screening event, just to kind of meet people where they are, meet where they feel more comfortable, offer a service that they may or may not be comfortable with having done in the past or haven't had it done in a while, just checking blood pressures. The reason that I agreed to be at this event and to provide this service is because hypertension is, you may or may not know, it's one of like the silent deadly killers in the body. It can cause a lot of long-standing health issues, chronic health issues. It can lead to many, many long-standing diseases such as kidney disease, eye disease, heart disease, pretty much anything in the body, all of the organs as well. And we wanted to give people an opportunity to get their blood pressure checked, ask some questions, find out more information about what else they can do to keep an eye on it, some signs and symptoms of low or high blood pressure. So that's really why we're here, why I chose it.
And evidence-based care is like, oh, this makes perfect sense. I see how I can do this. And then the regulated bodies is like,
and we're
not paying for that, we're not compensating for that. And you do it and you're volunteering your services, but at the same time, that person gets what they need.
And it's insane. Even if something as simple as antibiotics. You ever hear, I need an antibiotic for that. And it's like, that's a viral infection? But I know my body. Yes, you absolutely do. That's a beautiful thing. Well, we're causing antibiotic resistance and more problems down the line. C. diff down the line. You know what I'm saying? It's insane.
Resistance and then the expectation that it will be followed through again when you say that you need this care.
Right. But I think that's also the thing, like why I like working like with the patients and the population though, because especially when it's my people, right? So when it's my people and they come in and maybe they don't understand something, I go like, baby, listen, no, because you want to take these meds because this is going on and this is the problem. And I know that you don't trust that doctor because that doctor ain't make no sense, but let me educate you on this and this is how this goes. And they be like,
but is it mothering?
So that's what that
are you mothering them to some extent?
It is to a certain extent because that's where the safety is. The safety is like, yo, this lady really knows what she's talking about.
She really cares about me.
Yo, when my dad was in the hospital, he had like I think he had a bowel obstruction or something like that, right? And he wanted them like, he hard on the streets, but he's soft. If it's pain, he dying. He doing all of that. So they try to do the NG tube. A black woman, 2 black women comes in and he tells me, he's like, nah, these 2 black nurses, they told me, I'm gonna get that NG tube tonight. You gonna lay down. He was like, and they held me down to make sure they got that too. I only want to see them. That's the only people I like because he knew, like they told him, like if we don't get this down, you gonna be out your mouth again. Right. This, that, and the third. He was like, oh my, they know what they talking about. I ain't doing nothing for nobody. Like literally, and somebody would tell another nurse would say something. I ain't doing that, but let them come in. Oh no, so and so said I gotta do this because this is for my health. This is for I said,
how important is that to you? Like. For that type of situation to even occur, like to have that representation and to be able to trust somebody to tell you about what you should do and have that.
It's critical because first of all, as black people, like we already know, in mental health, right, black men are frequently diagnosed with psychosis and all these other things. Black women, right, for the anger issues and all that stuff. And you have, like, they're not giving no information. A black woman having a heart attack. Oh, you just got, the pastor at my church. She's like, she telling me all the symptoms. I'm like, you need to go to the hospital. Right now. She goes to the hospital. Or they discharge her. They say you just got a couple of problems. That's it. And what my mom did, we went to church the next day. My mom saw the lady. I told my mom, like, Mom, she's back home. She was like, yeah. I told her you're going to do the nose tonight because you said that she don't look good and she has to go back. She had to get, what was it, 3? She had to get a triple bypass. She had to get a triple bypass. Now, how y'all send her home the first time?
Because they dismiss. Black women's pain is always dismissed.
Yes. She said everything. She was like, it's really hard for me to get up the steps. I'm burning. My head is burning all the way down to my arms. I feel heavy. I can't do. I said, I need you to go to the hospital. Immediately. And she went. And they sent her home.
Dismissed her.
Yes.
Every
And
single
only
time.
because my mom knew and was like, listen, Arnetta said you're probably going to have to go back.
That's insane.
She would be dead.
Absolutely.
Right.
And black women die of heart disease and heart attacks so frequently. It's insane. We are dismissive of our own symptoms too, right? Because I'm strong.
Yeah.
I can do it. I can keep going. I'm a superhuman. And it's like, oh, my back hurt a little bit.
Listen.
I got a twinge in my heart. I got a pain down my arm.
Let me see if it goes away.
Yeah. Let's wait it out. Don't wait it out. Don't wait it out.
Yeah.
That's a scary part because you be like, I'm going to go in here.
They gonna tell me.
Seconds. Yeah, like, so you try to hold it on.
You run it hold down because you know what the expectation is and what you feel. You already feel it when you go in, whether they're going to believe you or not. It's insane.
Within the first 5 minutes, you know.
Absolutely.
You absolutely know. You're like, oh, they didn't really take my vitals. They didn't ask the right questions. You know, you're giving them additional information. They're like, oh, that doesn't really matter because you don't tell them that you're a healthcare provider. Because when you do tell them, then they automatically think that you think you know what's going on.
Yes,
so it's like this trying to play this game.
I don't say anything until the very last minute, and I'll say something. Yeah. And that's only when I really, really need to. Otherwise, I tell my family, stop telling people I'm a nurse practitioner.
Please.
Stop saying Dr.
Immediately.
Shardy. Please.
Yes.
Let's leave that at back.
Just don't be telling them anything.
Absolutely.
Yeah. It'll come out when it needs to.
Yes, it does.
Because I like to know, like, how do you treat people that you think don't know anything?
Absolutely. Like they're idiots.
Yeah.
Like,
and it's horrible. And then so I think about it like this. So if I'm a nurse and I'm giving slight clues that I know what I'm talking about, and you still dismissing me or acting like I'm just trying to get meds or this, that, and the third, I just can't imagine what these people going through. So that's the only reason why I won't leave like nursing them all the way.
Yeah.
Because if I
you
leave,
can.
somebody dies.
So and you're a mother too, right?
Yeah.
So I mean, even that's a big thing now. And the UK is picking up, and they're trying to do tons and tons of more studies to figure out what's going on over here in the U.S. in terms of black mothers and the mortality rate, you know, when they're birthing kids. So that's my question to you. Like, I know you guys have different specialties, and that's, you know, not necessarily the focus, right? But how do you feel about that, just being a mother? And then we know even recently, sorry to add it onto that, there was I can't think of the woman's name, but she was an advocate. She died anyway. Was a doula and served as a doula so that she can help birth people the right way and not just, you know, by whatever the standards are at the hospital and that kind of situation. And she died giving birth. So, I mean, that kind of thing, like, how does that affect you?
That's the thing that makes me stay in healthcare.
It affects us and knows us that the less of us that are here and present and vocal, then it becomes more of a challenge because we don't have the representation. We don't have the people with the experience, the people with the education that can advocate for each other. I went to the ER a few months ago. She was like, put me on speakerphone. I want to see these people. And we are having a conversation with each other while they're witnessing it. And that's how we change the trajectory. But it's difficult to do that when you don't have someone who you can do that with. You don't have someone who, when they walk in the room, they're even willing to allow you to be on the phone. And as a mother, my son went to CHOPD. He was dealing with a lot of health issues. I had to be on FaceTime with him quite a bit because sometimes you can't be in the room. So it's having that relationship with the healthcare providers that's important, because telling them like, hey, I know you see me, I know you see my chart, you don't need to read all of it, I will tell you all of the different things and you ask me what else you need to know. So it's telling people, this is what we got, this is what you see, but I also need you to know that I'm not sure what else is going on and this is what I'm thinking. So it's speaking up and writing your notes down, writing down your questions, all of the things. Yes, you have to say it out loud.
But you know what that reminds me of though? That reminds me of, so like a couple years ago, like my nephews like texting me like, yeah, Pop leaning over there in the car, and he's really like, he's like, it's 90 degrees outside. He's like, Pop, he got the heat on and he got this thing. So I'm like, all right, I'm coming to the house. My dad gets out the car, like I know something's wrong because he's like about to pee on the street, like he's a mess. So we get him to the ER, and I let them take his stuff, and I'm like, hey, he's off, like he's confused. I talk regular, like I was talking like a regular person. They let him sit in the waiting room. I gave him 5 minutes, and I was like, Mom, I don't know what's going on if they think this man has a full change in mental status.
Right.
And he's still sitting in this room. So I just went up real low. I didn't tell him who I was, what I do. I was like, so listen, this is a change in mental status. I need to see your charge nurse.
Right.
Because this is what's going on. This man is confused. He's not able to tell where he is, what's going on. This is a serious concern. I need him to be seen immediately.
Right.
My mom was like, I don't know what she told them people. But he had to get in the back. And then get him in the back. They get fluids into him, and the doctor starts talking like, oh, no, he's fine. He's normal. He's this, that, and the third. Ain't nothing wrong with him. He could probably be discharged. My mom was like, Arnetta, please. Like, before I even said, please.
So wait.
I said, now, listen, you're going to do my dad's labs, and I don't need you to say nothing to me until you get this culture back. He had sepsis. He had full-on sepsis. But if I wasn't there, they'd have discharged them. First of all, he'd have been in the waiting room.
Do you feel like what experiences contribute to you feeling like you, I guess, know more, see more, notice more? Because I mean, I'm just speaking as a person that has been to the doctors enough times, and we talked about this plenty of times over. High pain tolerance. I only go when I have to go, right? But even with that being said, I feel like it's only black people that have advocated for me, black doctors or black nurses that have advocated for me. I feel like even with my first birth, it didn't have to be what it was if they didn't disrupt the process the way that they did, and they would have listened to the black nurse, and they didn't. So, I mean, do you feel like that gives you an extra edge on caring a little bit more? I mean, let's be honest. Like, does that make you a little more sensitive to what people are actually saying to you, or when they come in, like, their actual issues?
I think a lot of it, some of it is cultural awareness and sensitivity. Like, if you see me as a black person, then you need to understand if I'm loud, that's the way we communicate at times.
And not all of us, but
not all of us, true.
You
if
can
I'm
still
quiet
hear
or
me.
reserved, that might also be how I
But you
communicate.
understand it when it comes
You understand.
up.
You have to understand the community you're serving. If you're serving in a mostly BIPOC area, and you're not a BIPOC person, and you wasn't raised with us, and you don't hang out with us, then you have no idea what you're dealing with. I could tell you I'm alright, and alright means I don't feel too good, like I'm not doing well. But then someone else can tell you,
I'm like, no.
So it's being able to recognize the differences and changes, the dialects,
the body language,
all of the things, and then even the concern depends on who they come with. If they come with someone and they're expressing concern, they're not like, oh, he's all right. They wouldn't have come because nobody wants to sit in the ER all day. So it's literally who am I serving? What do they look like? What do they need? And what are they saying? And if you don't understand the words I'm using, ask me to say it again. Ask me to use different words. Repeat it back to me. Reflect it in your own understanding of what I'm saying. Because if you don't understand what I'm saying, we're not communicating. And why are we here? We're wasting time.
So speaking of why are we here, I mean, you guys are here today to give back, and so I'm a segue. I told you I'm a segue. Because I want to know. I mean, you guys are serving. You guys are made a choice to give back today, and why is something like this important? I just want to be clear about where we are. We're at Chopped P.H.D. 1506 Sansom Street in Philadelphia, Center City. Of the black-owned barbershops in the city, Center City rather, there are two. This is one of the two, and he trained under the other one. So, I mean, this is a dope experience, and you guys have made a decision to come through today and support. And so I kind of want to figure out why, but in addition to that, I also want to just talk about men's health a little bit, just a tiny bit, because they are not coming in. I have a father who has had stuff happen that didn't have to happen because he didn't go in on time. So I kind of wanted to cover a little bit of that. And then why doing something like this in this kind of place is so important, and catching them in this place, and why this is a safety space, or what you feel about it just in general. I don't want to throw anything out there.
That's so much to unpack,
right? Yeah.
So the first thing, I think it's beautiful. So the first thing is most men, and not all of them, are given or provided with this macho, I can do this, I can do anything, and I gotta keep my emotions at bay. I gotta keep how I'm feeling at bay, right? And I've always said, I teach my son this all the time, it's okay to be sad, it's okay to cry, it's okay to do all of those things, but I need you to learn from this experience, right? So if you have this feeling, what does it mean to you? How do we keep it from necessarily happening again? That goes for any man in my life, right? Even my own father, he'll be like, I'm doing good. bro, your blood pressure 175 over
You are not doing good.
90.
And then you had Scrabble. Yes.
Scrabble bacon and sausage. Scrabble bacon and sausage, okay?
Yes.
So
Talk about eat healthy stuff.
you know, making or the barbershop also has been a place for men to express themselves, be who they are outside of everything else, right? So if they feel safe here, maybe they will say something. Maybe they will get their blood pressure checked, check their oxygenation. Maybe they'll even call their doctor and say, hey, listen, I ain't been here in a long time. Let's get this checked out. Even more so now, I'm seeing black men in general, being diagnosed with colorectal cancer, prostate cancer. And no, that's why I say to men my age, hey, listen, I understand. That's another thing that is like controversy. Go get your prostate checked. And if you're not going to get the physical exam, please get the blood test. That's a prick in the arm. It can be done. Again, I think this collaboration is amazing because you allow men to be who they are in their space while still helping them and assisting them. Even if I can just give you a blood pressure and say, get your blood pressure and evaluate that and say, hey, what you eat today? Are you taking any medications? Are you drinking enough water? Right? How many people are asking those questions that are outside of the healthcare field to that person? And it's like, you care. Yeah, because I want you here. All right, I'm going to give that much of a speech.
No, that
I'm going
was
to keep
good.
going.
So I think for me, like, one, this is in the same vein of like my own personal business, right? So it's like this is sex ed in unconventional spaces. So my target is actually barbershops, hair salons, boutiques, laundromats, bookstores, and all that kind of stuff, because this is where people go on a day-to-day basis, right? So if you come here on a day-to-day basis and you know how to have a casual conversation, because I'm good for a casual conversation, I'm gonna get you to tell one, all your business, that'll let me know what's contributing to what's happening. So you got these men coming in, listen, if you don't do nothing else, you're gonna get your hair cut every 2 weeks on clockwork. And so if I meet you where you are, where you going regularly, and I have you sit down and honestly, like this like small space, you can come in, lollygag and all of that stuff, and you get to come back to the safe space and I get to check your blood pressure. I'm talking to you, oh, how you been feeling lately? Any headaches, any pain? Because you know, usually you get back in the small space and you got somebody that, oh, I know that they know what they talking about. I'm gonna start telling them what's going on. I'm gonna start telling my problems.
Asking those
I want to throw that out
questions.
too, because you also can be an asset and advocate for them in that space as well.
Oh,
So,
huge.
yeah.
Yes, I'm huge with, I can get somebody to just, like, I don't know how I do it. I don't know what's going on. It's something on my forehead that says, cry
it
now
all.
if you need
Tell me the
to.
words.
Yeah, pull it all out. Like,
That's the thing.
but that's because it's like I'm a safe space. Like, I've been in mental health for a long time. And with that being my background, it informs me wherever I go. Like, I know you need to feel safe, because once you feel safe, we can actually get to the bottom of the problem. You know, people are like, oh, I ain't going to the doctors, this, that, and the third. But because we talking, right, I'm taking your stuff, I could be like, well, you know, this will happen, this will happen. I have a man who won't take care of his diabetes and stuff like that. And they want to flirt. And I'm like, but your blood sugars, I've been checking your blood sugars, they've been crazy. Ain't no way you enjoying your sex life. Because these are the effects. So like, you really got,
Well, get the people just like a 5 second about that. Tell them how that affects that. Go ahead.
Yeah, so that's what I'll start saying. Like, if your blood sugars are high all the time, you're not eating right, you're not checking them, you're not making sure everything is good, I don't think you're going to be enjoying the bedroom. You're going to be disappointing people. You're going to be, that's embarrassing. Don't you want to? And the guy would be like, you know, you ain't lying. Take my blood sugar. After they done refused, so they're not taking it. Because you out here trying to please the people.
But you
But because I ended up talking to him like that, they be like, damn, you ain't lying. Yes, I already know it's not what you saying. Because I'm a nurse, right? They be like, yeah. And then we just get into it. But they become more involved. Like, with their health. Now they telling the doctor the truth. Because they done lied to their doctor. I've seen my dad do it. Argue me down.
So I guess I want to hear from Melissa too, but I guess my next question is, there like a tell-all book of, no, I'm joking. Go ahead, Melissa, what's your
I think the significance of meeting in a barbershop per se is they walk in, as Arnetta said, they're comfortable. They already know who they're going to see. And then if they see the same person once a month or whatever, if we're doing the blood pressures on a consistent basis, they'll be like, oh, I know that that nurse gonna be here. She said she'll be here next month, so she'll check it again. And if they didn't go see their primary or their provider since the last time we saw them, be like, Mr. Jones, you know, like 3 times in a row, it's been kind of elevated. How's your headaches doing? You drinking more water? How them bowel movements going? You still in the bathroom for a minute? Like, those are the things they need to be aware of. And it's just having a conversation about things that are so difficult to understand that we're making it a day-to-day conversation. We're making it so it's easy for them to understand. So I really think doing it for them, making it easy, accessible. We're not charging $1 million. Like, this is a complimentary service. It's not saying, oh, you got to make an appointment, you got to do this, you got to do that. If you're walking down the street and you see us here, come through. That's it. Yeah.
And I know I'm coming to the barbershop, and I know nurse so-and-so there. Oh, I gotta give it. It's like they automatically do homework. Oh, I know I'm about to see so-and-so, so I got my blood pressures, this, thing, and third. And they come in, oh, I got my stuff. See, it's like the perfect place to like keep the engagement rolling. And it's not the doctor's office. Because even me as a professional, I'm in the doctor's office like
waiting patiently, losing it.
They about to sit here and go through the motions, and then they really not gonna listen to what I say. No, I come here. This person ain't judging me.
Right. So I want to ask y'all one final question, because I know we're dealing with people of faith too, so I just throw that little tidbit out there. So essentially you guys are honoring that, becoming all things to all men, and then meeting people where they are, and allowing people to come in, you know, as they are, you know, like come however they are, and you're meeting them in a place that feels comfortable. So I mean, honestly, what does that mean to be able to even do that?
Dropping the barriers, right? So I can have a preconceived notion about someone, or they can have a preconceived notion about me, but getting to know that person, right? What is it that may be blocking that? So I can use an example. If someone doesn't have on enough clothing, or clothing that has holes in it, maybe that's the best that they have. And to the eye, we're like, oh, they're a little disheveled, they might not even smell great. But what are you doing to improve that? You gotta drop those preconceived notions. It's not necessarily, oh, that person is addicted to drugs. Like when you mentioned that your dad was incapacitated and had the altered mental status, most people would dismiss that man as saying, oh, he's high or drunk, right? So we need to wash that away. And it is a natural human response sometimes, but you wash that away and your compassion comes through, and it's like, no, I'm going to make this person better. An example may be if you get to a patient's home, I go into home care, and they're soiled. Their home health aide or someone else is burnt out, right? Let's go ahead and clean this person up for them. People will say, oh, I'm not a CNA, I don't do that.
Yes.
I will do anything at this moment in my career to help a patient feel better. So who wants to sit in their
faces? You're doing a lot right now. I just want to throw it out. The gentleman, the owner of this shop, Saya, he has mentioned before he, has white coat syndrome.
White coat syndrome. And I was like, what's that? She's like, when you see a white coat, your blood pressure go up. When you see somebody dressed up like a doctor, she's like that. So she was my primary physician at the time. When she used to come to see me, she used to take her coat off. And she's like, you never pay attention, your blood pressure's lower. So when the nurses come, I don't say just regular clothes, but they still had their credentials and they can just let the guys know. So a lot of dudes have that. A lot of women have it too, but dudes more than women.
And other people have white coat syndrome. So even y'all coming in here, just comfortable and regular. And so like if I come into this room, I don't know, what's going on, but in a good way. Like y'all have the pamphlets, you have everything set up, you have all the tools and stuff necessary, but it doesn't feel threatening. It doesn't feel overwhelming and that kind of vibe.